coronary heart disease. It's a subject we all take very seriously. For adults with either existing or suspected heart disease, getting the most accurate diagnosis and proper treatment plan is crucial to our peace of mind and long-term health. We're honored this morning to have with us Dr. Robert Bobner of Ochsner Health System in New Orleans, who's here to discuss specific advances in cardiac diagnosis and patient care. Good morning, doctor.
Good morning. How are you?
Thank you so much for being here.
Thank you.
You know, this is really important to talk about coronary heart disease because it is the #1 killer in America, correct?
Correct. There are about 13 million people afflicted with this every single year. And not only does it kill people, it also brings people suffering and agony. So it's important that we treat it at its earliest stages.
And the symptoms when someone is suffering through it?
Well, most people will have chest pain or chest pressure, but it's not only chest pain or pressure. A lot of people become short of breath. Some people may have radiation up to the jaw or down the arm, and some people actually get it in their back.
And is the onset quick, or can it even approach slowly?
It varies. Some people it can be quick within a couple weeks. Other people it can be very chronic over several months.
And we wanted to know how aware people are about heart disease, so we decided to ask a few men and women out there in terms of their knowledge. You want to take a listen?
Sure.
Let's take a look.
What are you doing to keep your heart healthy?
Well, I do several things actually. I eat well. I know that inflammation's really important, and so I'm a vegan. I eat mostly vegetables and fruits and a little bit of grains.
I'm not really doing anything to keep my heart healthy.
How do you know if you have risk factors for heart disease?
I usually do a checkup every year with my doc, so it's a total checkup for blood and hearts.
Most importantly, you need to see a doctor, and you need to get a good physical every once in a while to check out your whole cardiovascular system.
Different responses, obviously, from everyone. Now, let's talk about the different diagnostic procedures available today.
Okay. The most common procedure that we use to diagnose coronary artery disease is a stress test.
My dad just has one.
And we have various varieties of them. The most common and basic is a treadmill stress test, where you get on a treadmill and you jog on it, and we monitor the electrocardiogram. And sometimes that can determine whether or not there's existing disease. But often that's not good enough, and it won't detect everybody. So there comes your nuclear stress tests, and your dad has probably had these as well. Many years ago, they were referred to as the thallium stress test, and that actually had quite a bit of radiation. Now we're using cardiac PET stress testing, and this is much more accurate. It can detect disease on a much finer scale, and also it's a lot less radiation involved with the test.
And a lot of people, obviously, before they take such exams, they always wonder about some safety issues. Are there any that patients should be aware of before they do a cardiac PET exam?
Really, it's actually a very, very safe procedure. You have an IV that's placed. We give you medication that will stress the heart, and then we inject you with a little bit of a radioactive material that goes to the heart so we can actually image it. And there is some radiation exposure, but it's very small.
So definitely worth it in the long run in terms of detecting.
Absolutely.
Now let me ask you about the difference, I guess, between men and women. I mean, let's be honest, we know physically the differences, but in terms of heart disease, are they alike?
They're similar, but there are differences. Men tend to have disease earlier than women, sometimes even as early in their 30s or 40s. Women tend to be a little bit later in general. Also, women tend to not have the classic symptoms necessarily, that is the chest pain. They may present just differently. They might have chest pain on the side, perhaps down the arm or in the jaw, but they often don't present as the typical patient. So for women, they need to be particularly careful about any symptoms, as it may actually be coronary disease, and they're just not aware of it.
Now, you brushed upon the exam a little bit. Let me just ask you a couple more questions. If someone's going to go in and take it, how long does it last? Will they feel kind of like that anxiety or that kind of pressure? Tell me about that.
So the exam itself takes about 30 minutes from start to finish. The medicine that we give to stress the heart tends to make people feel flushed, maybe have a racing heart rate.
But all normal?
All very, very normal, and it goes away in about 5 minutes. And the scan itself is painless. They just have to lay down in the scanner and let the scanner take the pictures.
And in the long run, it could be the difference between life and death.
Absolutely.
Thank you, doctor.
Thank you.
I appreciate your time.
Thank you.
And if you'd like more information on today's cardiac procedure that you just heard of and heart disease prevention, please visit the website. It's CardioGen.com. That's CardioGen.com. And reach out to us on Facebook, sharing any thoughts or stories relating to this vitally important topic. Click on Facebook and go to Balancing Act Fan.